Hello, everyone. Welcome back. My name is Hema Dhungel, and I'm a member of HFN. Today, we have a second video on sleep, and this video is going to be hosted in English because we had a lot of public demand to be held in English, and so it can reach a wider audience too. Today's video, we're going to talk about some sleep disorders and the importance of sleep. And today, we have a special guest. Her name is Dr. Sushrusha Arjyal. She's a psychiatric sleep specialist, and she's also a vice president of Health Foundation Nepal. Dr. Sushrusha, welcome to our interview. Could you tell
Thank
us
you so much,
about
Hema.
yourself?
Thank you. I'm glad to be here. Thank you for the nice brief introduction. So I am a psychiatrist and a sleep specialist. I am currently practicing in North Carolina. I'm doing mostly outpatient, and I see a lot of patients with different sleep disorders and patients who have combined psychiatric symptoms and sleep problems. I am also the vice president of Health Foundation Nepal. I have been working in Health Foundation Nepal for almost 5 years now.
Great. So we all know sleep is so important to us. We spend almost, 7 to 8 hours sleeping throughout our day. So can you please tell us more about, why is sleep so important to us? Why does our body need sleep to function?
That's a great question. So we need sleep sort of to re-energize ourselves. Sleep has different functions, including the deep sleep will help with your memory function. Sleep, in fact, is associated with good sleep is cleansing the beta amyloids that can cause Alzheimer's. So sleep has different functions, including improvement of memory, making people more alert during the day, giving them sort of resetting our whole system. Let's just put it that way.
Mhm. How is our body affected when we don't get the different types of sleep? For example, you said there's like good sleep, and then there's like just like a sleep you get where your body is like doing some functions, but it's fully not doing what it's supposed to. Let's say if someone is sleeping for 5 hours, defer to someone who's sleeping for 7 to 8 hours. Like, is our body still capable of doing what it's supposed to do in 7 hours of sleep in that 5 hour? Like, how does that work?
So, according to American Academy of Sleep Medicine, a healthy adult requires 7 hours of sleep. The number of hours changes as kids need more sleep than adults, babies need more sleep than the toddlers, so the requirement does change. But having said that, I see a lot of things that we do during the day affects our sleep at night. So I tell my patients, your sleep begins in the morning. What you do in the morning kind of like dictates your sleep at night. To answer your question of like what happens if someone sleeps just 5 hours, right? So people can get very tired. People can be sleepy during the day. They can have motor vehicle accidents because they're so sleepy. They can be less focused because it affects your memory, your focus, your concentration, their ability to even maintain relationships, right? Show up, do different things that can affect if people are not getting good sleep.
What would be like a long-term effect if an individual is getting very less amount of sleep every night? I mean, there can be personal reasons for everyone, not to get enough sleep per night. But can you tell us a little if it's like a consistent, for long term, if you're not sleeping well, what are like some symptoms your body will start to experience?
First of all, we'll have to understand that if someone is not consistently sleeping well, there can be cardiovascular, like, changes affect in your heart, your memory, your blood pressure, your overall functionality. So it does affect that and your overall health, basically. However, what we need to understand, and that is something that we need to sort of make the public aware, is nobody can sleep 7 hours each day, every day of their lives. So a little bit of sleep disruption, sleep disruption is normal. Okay. We do not want to catastrophize insomnia too. We do not want to say that, hey, we didn't sleep well for last night, so what's going to happen? Because what happens, and that's something that I have seen in, happening in day-to-day life, is people get very anxious about not sleeping. And when they get very anxious about not sleeping, what happens is they don't sleep. So we will have to keep that in mind. Sleep changes from every day, day to day. Whatever you do during the day, whatever you do, your sleep hygiene practices at night, it affects your sleep. And it is okay not to have that uniform 7 hours every night. If it, when it becomes insomnia is when people start, sleeping less than 7 hours consistently, and when it affects their life. And this should be diagnosed by a sleep specialist.
I guess a person will know the patterns of their own sleep schedule, and if they're getting consistent lack of sleep and it's affecting their body, physically, how would that person, kind of start to improve their sleep? Like, is there anything else you can do at home, practice some sleep hygiene practices, or would you see a sleep specialist? Is that the first thing you should do, or are there other steps you can take to, kind of relieve the symptoms of insomnia or something? Steps you can take for you to like sleep better at home?
Definitely, I mean, first, and that's probably one of the, objectives of this video, is to make people aware of like what to do first, right? So what we can do is to have better sleep at night. There are certain factors that are not modifiable, right? I mean, there might be stressors in your life. People might lose jobs. People might lose their loved ones. I mean, there are certain factors that you don't have control over. But the things that we have control over, we can change, right? So one of the things would be to have a good structure to the day. So waking up like, early. And by early, I don't mean like, very early, but waking up in a certain time in the day. And then having a good structure to the day, planning your day, socializing, meeting with people, that will help. And then, not having too much caffeine, not having caffeine after noon would be helpful. A little bit of exercise, about 30-40 minutes of exercise daily, interaction with family and friends. And then at night, preparing for the bed, right? Meaning having dinner a little bit early, not consuming alcoholic beverages, at least not in excessive amount. Not consuming like cigarettes or those kind of like, or any kind of drugs. And then preparing for the bedtime, meaning preparing your bed just to sleep. So not reading in the bed, not doing anything else, not using electronics. So having that 1 hour of pre-bedtime, preparing for your sleep is very helpful. And one thing we have to remember is, to change our habits, we will need to be consistent. So it is a process. So you start with a small step, and then you become consistent with that, and slowly the change begins to happen. Intermittently at night, if you don't get sleep, you don't want to stay in the bed trying to fall back to sleep. This is a very common misconception, that if I wake up and if I get out of the bed, I will lose my sleep. It's actually the other way around. If you stay in bed trying to fall back to sleep or trying to fall asleep, you're actually conditioning your brain to think that it is okay not to sleep. So we have a very, elaborate therapy for insomnia, which is called cognitive behavioral therapy for insomnia. So if, working on sleep hygiene and doing things by yourself, if it fails, you could see a sleep specialist, and you could also see a sleep psychologist for therapy for insomnia. So that is something that is very effective in, improving your sleep.
So I think we have talked a lot about insomnia, and if there are any other questions that come as we go, we'll touch base on that. But I know there's also sleep apnea, which is similar to insomnia, but different in other ways. And can you please tell us like the similarities and differences between insomnia and sleep apnea, and how like what each person is experiencing?
So, see, there are different sleep disorders, right? Insomnia is one of them. Sleep apnea is a different sleep disorder. And there are other sleep disorders like parasomnias. And then there are sleep disorders of excessive sleepiness, like narcolepsy, idiopathic hypersomnolence, So sleep is a specialty in its own. When we are talking about obstructive sleep apnea, so there are different kinds of sleep apnea. So today, for the sake of time, I'll focus more on obstructive sleep apnea, because obstructive sleep apnea is very, very prevalent, especially like, I was reading an article, and about 39 million Americans have obstructive sleep apnea. So, and it is very underdiagnosed too, because people are not aware yet, of what obstructive sleep apnea is and what are its long-term effects and how to approach it. So obstructive sleep apnea, as the name suggests, is if there is any kind of obstruction, and there is less, like the airflow, the channel is narrower than it should be. It could be because of different reasons. In kids, it could be because of, the tonsils are big, and then they need tonsillectomy. In some people, like if they are obese, there is this fat infiltration which can make the airway narrower. And people can have like thick tongue, crowded airway, the alignment of teeth. A lot of things can cause obstructive sleep apnea. So when the airway passage is narrow and the air is trying to go in, and of course, like, we breathe in and we breathe out, right? There is this noise that the narrow airway makes, and which comes out as snoring, right? So snoring is one of the features of obstructive sleep apnea. When people have those small pauses in breathing because of the airway being narrow, when we breathe in oxygen, we breathe out carbon dioxide. So when carbon dioxide starts to accumulate in our system, what happens is there are micro arousals. Like, people might not necessarily wake up, but there are small arousals, and then in one of those arousals, people would wake up like like that, gasping for breath, which is another symptom of obstructive sleep apnea. And then, because people have been waking up so many times at night, which apnea is like technically like pause in breathing, hypopnea is reduction in breathing. So that's how apnea hypopnea comes in obstructive sleep apnea. Okay. And then because of that, what happens is, the patient, generally the history looks like this: I snore heavily, I wake up gasping for breath, might or might not have high BMI, right? Meaning patient might be obese or might not be obese. They might have family history of obstructive sleep apnea or family history of snoring, and they might just say, hey, all of my family members snore, but we have never gotten a sleep study. That could be the history. And also, these patients, what they say is, I can sleep 8 hours, but I never feel rested. I'm always very, very tired. And I have been sleepy behind the wheels. And sometimes they would say, I'm not necessarily sleepy, but I feel like I have to pull over because I'm so tired, or I have avoided driving long distances. I've heard this a lot, driving long distances, and I just don't know why. I'm very fatigued. And some people are outright sleepy, So these are the symptoms of obstructive sleep apnea, and that's what brings people to a sleep specialist mostly. Okay. So what do? You should get a sleep study. You find out if patient actually has sleep apnea or is it just snoring. And if patient actually has sleep apnea, why do we have to treat it, right? Because when people have sleep apnea, what happens is they have those pauses in breathing, which interferes with our cardiovascular system, meaning if the oxygen goes down, your blood pressure goes up. And these patients are at risk of worsening of hypertension, which is blood pressure. They are at more risk of arrhythmias, like when your heart is not kind of going at the normal rate at it should, right? And there could be several types of arrhythmias. And also these patients are at risk of motor vehicle accidents during the day because they are so sleepy.
Yeah.
The way that we can treat obstructive sleep apnea, I mean, there are several ways. I'll just focus on one in this video again for the sake of time, is they could go to a sleep specialist, they could get diagnosed. If they have sleep apnea, there are machines available, CPAP machines, continuous positive airway pressure. So the machines can help open the airway so that patients can breathe and sleep at the same time. And it's a fairly non-invasive process. And there are other options like surgical options. There are different options, but a sleep specialist should be able to elaborate on all of those depending on how your sleep study goes.
Yeah. Is there like a difference between like a female and like a male like sleeping patterns? Like a, for sometimes like a male can have an easier time going to sleep because of how their body is designed versus like a female. Because I know I've read well, I've heard about how like when women go through menopause at that stage, their sleep can be heavily affected. And do you know why? Because I'm curious too. Because I know my mom is coming to that age and she sometimes complains that, she's having a hard time sleeping. What do I do? I've tried everything, but it's not even like a disorder. It's just like a hard time sleeping. And
Yeah,
yeah,
yeah, no, absolutely. See, if we have to, like, I'm, in some sleep disorders, it is like more, gender-based that way, if you could call it, right? Like the prevalence of insomnia is more in females than males. Prevalence of obstructive sleep apnea is more in males. There are disorders which we call REM behavior disorders, in which people act out in their dreams, so those are more common in males after like 60. And then to your point, the hormonal changes, and then insomnia during menopause is really important topic to discuss about. And so yeah, there are a lot of factors that can affect your sleep, and hormonal changes is definitely one of them. Anxiety is something that we need to treat in order to help with sleep. And there are ways that there are medications and there is therapy, and there are ways where how you could address these problems. And it is best sort of discussed by the individual patient with the sleep specialist. But there are medications that we can give them.
what do you guys think about? I know melatonin is a popular supplement that people take over the counter, to practice healthy sleeping. So would you guys recommend that to someone who's having hard time going to sleep, like kind of getting used to the melatonin?
So one of the things that I recommend, and very honestly, is once you have tried sleep hygiene, once you have tried keep having a structure to your day and reducing electronics and everything, it's best to get the help of a sleep specialist or your primary care physician before trying any medication. That includes over-the-counter medications, because what happens is medications come with their side effects.
Mhm.
Even the supplements come with their side effects. And I have seen cases where patients were taking supplements, over time, and that didn't affect their sleep in a good way. So, my best advice as a sleep specialist would be, if things are not going well, please seek help. And also, of note, I mean, because we're making this video, one thing that we have to remember is a lot of prescription sleep medications can cause dependence. Then they can have withdrawal symptoms. So always get an expert opinion and individually. And I'm saying individually because it is hard to generalize, because patients can have different, even insomnia is of many types. There can be sleep onset insomnia, and there can be sleep maintenance insomnia. There can be people getting up early in the morning and not being able to go back to sleep. So all of these have to be discussed with the patient, know the patient individually, and then suggest the treatment accordingly.
Mhm. So I think to wrap up our video, I think we've covered a lot of general information that people would, benefit from. We talked about why sleep is important, why we need sleep, why our body needs sleep, the long-term and short-term effects sleep has on our bodies physically, and I think mentally it can have a profound effect on you. And then we also touched on insomnia and
Active sleep apnea, that's okay.
and Dr. Arjyal shared a lot of tips on hygiene and how you can improve your sleep. And if all of these things, if you're practicing sleep hygiene, um, sleep taking supplements, please, see your provider first. Then I'm sure the next step is then they send you to the sleep specialist. And then
Yes, if your primary care physician, it's appropriate to send, or if you need more help, yeah, absolutely.
yeah, and if you have any other questions, we would be happy to make another video with all the questions people will have, and we'll only answer those questions and focus on that. But do you think we should talk about any other things, Dr. Arjo? Is there any other important advice you would want to give to the audience?
Yeah, I think one thing that as a sleep specialist that I want to kind of ask people to be aware is, again, sleep is important. It is very important, but there is something called psychophysiologic insomnia too. I mean, paradoxical sleep. So what I mean is the less worried we are about our sleep, the better we sleep, you know. So treating anxiety is very important to help with your sleep, you know. And then there are different factors that go into contributing towards your insomnia. For example, if someone is suffering from chronic pain, treating that pain is important to improve your sleep, right? So we have to, again, gear towards individual patients, and you have to seek help and find out what is actually happening before proceeding towards like any kind of treatment, because that is absolutely important to know the history, share your history with someone, so that someone can, like any your primary care physician or sleep specialist, can formulate a plan with you. That's something that I would say. Thank you.
Awesome. And hopefully, people learned a lot from this video because surely I did. And if there are any other questions, we will bring it up again. And I think we're going to bring this interview to an end. Thank you.
Okay, thank you, Hema. Thank you so much.